right, here we go. Question number 11. The nurse has a pre-op order for Valium or diazepam, 10 milligrams, and Phenergan, which is promethazine, at 25 milligrams. The correct method of administering these medications is to what? Administer the medications together in one syringe, administer the medications separately, administer the Valium, wait 5 minutes, and then inject the Phenergan, or question the order because they cannot be given at the same time. The answer is B. Administer the medications separately. Medications should not be mixed in one syringe unless indicated by the physician. Pharmacological and parenteral therapies, they have different components, right? Yeah, so pharmacological and parenteral therapies, 13 to 19%, making it the second largest section on the NCLEX exam. So here we go. Question number 12. A client with frequent urinary tract infections asks the nurse how she can prevent the reoccurrence. The nurse should teach the client to what? All right, so based off of this could be what? This could be a health promotions question. It could be a reduction of risk potential, right? So is it A, douche after intercourse? B, void every 3 hours? Is it C, obtain a urinalysis monthly? Or is it D, wipe from front to back after voiding? And the answer is B. It is to void every 3 hours. Voiding every 3 hours prevents stagnant urine from collecting in the bladder where bacteria can grow. Health promotions and maintenance, which is 6 to 12% on the NCLEX exam. Here we go. Question 13. Which task should be assigned to the nursing assistant? This individual is the UAP, unlicensed assistive personnel. Placing the client in seclusion, emptying the Foley catheter of the pre-eclamptic client, feeding the client with dementia, or ambulating the client with a fractured hip, right? Now, with somebody who's a UAP, what is the scope of practice that they can do, right? Now, this essentially is a management of care question. Management of care means assignment, delegation, supervision, right? So you as the registered nurses, what would you allow for them to do within their scope of practice? And the answer is C, feeding the client with dementia. Of these clients, the one who should be assigned to the care of the nursing assistant is feeding the client with dementia, right? Here we go. Question number 14. The client has recently returned from having a thyroidectomy. The nurse should keep which of the following at the bedside? Is it a trach kit, a padded tongue blade, an endotracheal tube, or an airway? And by an airway, you mean like an oral airway. What are we thinking? But the answer is A. It is a trach kit. All right. So a client who has recently had a thyroidectomy is at risk for tracheal edema. This is why a trach kit needs to be at the bedside. This is part of reduction of risk potential. Question 15. The physician has ordered a histoplasmosis test for the elderly client. The nurse is aware that histoplasmosis is transmitted to humans by what animal? Is it a cat, a dog, a turtle, or birds? What are we thinking? Histoplasmosis is D. Histoplasmosis is a fungus carried by birds. Histoplasmosis. But anyways, ladies and gentlemen, that's part of physiological adaptation, 11 to 17% on the NCLEX, which is the third largest section on the NCLEX exam.